Thyroid ultrasound is a non-invasive imaging technique used to assess the structure, size, and echotexture of the thyroid gland and surrounding cervical structures. In a normal study, the thyroid gland is typically located in the interior neck, with right and left lobes, lying on either side of the trachea and connected by a thin isthmus. Each lobe of the thyroid demonstrates smooth, well-defined margins and a homogeneous echotexture. The gland appears uniformly medium to high echogenic relative to adjacent strap muscles, which are seen as hypoechoic structures interior to the gland. No focal lesions, nodules, or cystic changes are identified. The isthmus is visualized clearly, measuring within normal limits, usually 2 to 6 millimeters in thickness, and appears similar in echogenicity to the lobes. The dimensions of the thyroid lobes fall within normal ranges. The length of each lobe usually measures 4 to 6 centimeters, with an anteroposterior diameter of 1 to 2 centimeters and transverse diameter of 1.5 to 2.5 cm. Overall thyroid volume is within physiological limits, with no evidence of enlargement or atrophy. Color Doppler examination shows normal vascularity, with symmetric blood flow patterns in both lobes. No evidence of increased or decreased vascularity is observed. There is no intrathyroidal calcification, hemorrhage, or abnormal fluid collection. The parathyroidal fat planes are preserved, and no abnormal cervical lymph nodes are seen in the parathyroidal or jugular chain regions. The trachea is midline without displacement, and there is no mass effect on adjacent soft tissues. Overall, the ultrasound appearance is consistent with a normal thyroid gland, with no signs of diffuse thyroid disease such as thyroiditis, nodular goiter, or neoplasm. Normal thyroid ultrasound with homogeneous echotexture, normal size and vascularity, and no focal lesions.